Hey guys, it's Dr. Martin here from Haven Physical Therapy and Haven RX. I want to give a quick shout out to Julian. Thanks for posting this on my timeline, Julian. I really appreciate your inquisition on this one, and I look forward to explaining what's kind of going on in some of these videos. Great videos overall. Anatomy is definitely really important to understand whenever you're pushing heavy weights around, but there's some things in these videos I want to make sure that we point out that's not so accurate. Overall, great videos, and thanks once again, Julian, for posting these. So the first video we're going to go over here is the preacher curl. Now, in the CrossFit box, we never do preacher curls. We don't have any exercises really where we're sitting around, which I really like. Nothing wrong with this exercise at all. Let's go ahead and play the video, and we'll kind of talk through it as it's playing. So what you're seeing right here is pretty common at the gym. As the weight drops down, you're getting the stretch on the biceps, and like the video will show here in a second, you have two attachments to the scapula here through the long head and the short head of the biceps. Now, there's not anything particularly wrong with this exercise, but the only thing is you're going to be working thoracic rotation as well as biceps musculature. So not inherently wrong, but there is a better way to do this. So I'll let the video continue to play here. Coracoid process where the short head attaches, and then there's also an attachment to the labrum with the long head of the biceps as well. So that one's really important for that internal shoulder pathology. You want to make sure you protect that long head of the biceps because you don't want a slap tear of that labrum. But that's a side note there. So as you can see, holding that scapula in place, for some reason he can't extend his elbow all the way out all of a sudden. That is very true. If you always let your scapula protract and move forward, that biceps may not be getting that adequate stretch. I mean, it's not necessarily a bad movement. You just want to know what you're trying to accomplish, and as long as the biceps is getting enough stimulation and it's being trained through that full range of motion, you're still going to get the hypertrophy effect. However, if you want this to translate better over to something, say, like the ring dips, you really want to focus on that scapula positioning. If you can hold that scapula in place a little bit better using the lower traps, the rhomboids, and all those accessory muscles through here, like this little figure is doing, then you're going to teach that shoulder blade to stay in better position in things such as the dip whenever you're having a stretch on the biceps being back into shoulder extension there. Now, see what else I have in my notes. I mean, we definitely want to eliminate that compensation because you're going to train the biceps more efficiently, because that's what this exercise is designed for. It's designed to get maximal hypertrophy of the biceps, and it's not designed to get some hypertrophy of the biceps and then also work on the shoulder protraction, retraction. I think that's all I have on that video, so I'll let it kind of continue playing out here. As you can see, some of the things that you may be compensating for is having too much resistance. So if you have too heavy of a weight, you can't control that shoulder blade. Of course, you're going to get that quick stretch on the biceps, and it's going to pull that shoulder blade forward. We'll go ahead and skip to that next video over there. Oh, the old famous leg press. So once again, we don't have this machine at the box, but we do something very similar, and that's the squat. Whether it be back squat, back squat, front squat, you're doing the same movement, but you're typically not getting as deep right here. I don't see many people squatting where their thighs are touching their chest. So I'll let it kind of play out. What he's going to show here is whenever he gets too low, he gets a little bit of lumbar flexion that occurs right there, and that causes the pelvis to tilt posteriorly, and they get the lumbar flexion. Now, in the squat, you typically see this, and it's called the butt wink. Essentially, someone drops too low, they run out of room in their hips, and or they can't control the muscles, and essentially their lumbar spine flexes and their hips posteriorly tilt right there. So, you know, the cues that it gives here in just a second aren't necessarily that bad, and they're actually really good muscle control cues. However, one thing it doesn't account for is some bony anatomy. So we'll watch the cues real quick. I'm not a big fan of this. It can cause low back discomfort, but it's not always going to cause it. Essentially, these tissues are really resilient tissues. You're not at risk for injuring your back doing this a couple times at low weight. If you pop, say, 500 pounds on the leg press machine and you do this repeatedly, yeah, absolutely, you can irritate those tissues, but they're not going to catch on fire like that. That's a perfect example of what I was talking about. Let's go back just a little bit. When you run out of... not far enough. When you run out of room here, of course that circle is going to be in the way, in your hips, whenever you can't do any more hip flexion, what your pelvis is going to have to do in order to get deeper is to cause posterior tilt. So that pelvis rotates back, and that causes the lumbar spine to rotate back as well. And a little bit of compression does occur, but once again, it only is painful if you exceed the tissue's capacity. Solution 1, good idea. Let's slow the movement down and learn to control all the way deep into that squat right there. Now, let's go on to the next one, and I'll kind of explain something that the video doesn't touch on. Another good cue. Yeah, if you wanting to learn a better control of your lumbar spine, now it's not going to be neutral. No matter what you do, every time you do a squat, there's going to be some lumbar flexion that occurs. So neutral is kind of a myth. No matter who it is, even in a well-trained individual, there's going to be some lumbar flexion that occurs. Studies show that over and over again. So this myth of a neutral lumbar doesn't really happen, but a better controlled lumbar absolutely is what you're going for. So a good cue here, it teaches you to maintain that pelvis and that sacrum against the surface while controlling that deep hip flexion. And you can see if you get that butt wink once again, that band comes out. Now you can't do this particular drill at the gym, but I'll make sure that I post in the comments section. I did a video a while back training the hips and abs to control that full hip range of motion without losing that lumbar spine. So one thing that this video doesn't account for is bony hip anatomy. So it doesn't show that if this person were to maybe, say, bring their feet in a little bit closer, drive their knees out a little bit further, creating more external rotation in the hip, that would provide more room in that hip socket, and they'd be able to drop deeper without that pelvis having to go backwards. So a lot of times what I'll see in the gym with someone with that anterior hip pain or that pain in the front of the hip that feels like a pinch with that deep squat is we play with their squat stance a little bit, and they're able to go all the way down into that deep squat without pain. So this myth of your feet shoulder width apart, toes always pointed forward, drive your knees out, doesn't work for everybody. It's a good coaching cue and it's a good baseline, but everyone's hip anatomy is going to dictate how they can squat. So some people need a much wider stance with their toes turned out and then drive their knees out in order to provide a little bit more hip external rotation. That's just because their acetabulum and their femoral head are designed in a way that if they were to go narrow squat stance, they're going to get a little bit of impingement into that capsular region. Now, a lot of times I'll have people play with their foot position, and I teach them a little bit about hip anatomy by popping them down on the ground and driving their hips up and finding that comfort zone for them. If you ever have any questions while you're at the gym and you're one of those people that's having that pinching pain in the front of the hip with your squat, feel free to, tap me on the shoulder and ask me, like, hey, would I take a look at your squat? I would absolutely love to. It takes not more than probably 2 minutes to retrain that squat and teach you how to get deeper without that hip pain right there. Let's see if there's any other notes. So no other notes. So once again, I'll make sure that I post the link that has the other exercise that you can do at the gym. With the bands, teaching that hip full range of motion while controlling the lumbar spine a little bit better. Alright, on to the next video. The wonderful bench dip. Yes, your anterior deltoid does get some compressive forces. Now, this isn't necessarily a bad thing because you're taking the anterior deltoid on a stretch and then you're going to contract it a little bit to help stabilize that shoulder whenever you're coming back up. You could get a little bit, one thing I could see from this is getting a little bit of tendinopathy or a muscle strain from this, just because you're getting that compressive force. However, it's really unlikely for anyone to get anterior deltoid tendinopathy from this. There's the capsule and some of the ligaments that help stabilize the shoulder. Cool to know that anatomy if you want to know that. Yes, this position does put you in shoulder hyperextension. So one way this translates over to the CrossFit box is, say somebody doing ring dips. You're going to get that shoulder extension, but we'll talk about it in a second how ring dip is actually a more effective and a little bit safer than even the bench dip. So one thing I don't like about this is it talks about maximal stretch of that anterior capsule. Yeah, absolutely, you're going to get a stretch of that anterior capsule, but throwing a baseball is going to get probably even more stretch of that anterior capsule than say a body weight dip like this, because it's a ballistic movement. So what it says here is, you're getting a stretch on the anterior capsule, and it reduces the ability to stabilize the shoulder joint and a high risk for injury. I would say that's probably true, once again, if you only exceed your tissue capacity. So if you're a new lifter and you try to do 100 bench dips with weights on your hips, that's probably going to irritate either the capsule or the biceps tendon as well, because you're getting a stretch on that long head of the biceps. More likely to have an irritation like a tendinopathy than to actually stretch out that capsule, because remember, it takes around 2,000 pounds of force to deform that iliotibial band that runs along the side of your leg, the IT band that everyone knows about. It takes more than 2,000 pounds of force to deform that 1%. So it's a lot of force required to actually make this tissue itself stretch. So unless you're adding a lot of weight on your hips and you're doing a one-arm bench dip, you're not going to stretch that capsule out to the point where it's going to cause long-term issues. In fact, over time, you're likely to have a thickened capsule because you're stressing the collagen, and that collagen is going to respond by creating even thicker collagen over time. Consider whether there is a better exercise alternative, and I would say there is one, and that would probably be the ring dip. Because what you're getting with the ring dip that you're not getting with the bench is your trunk's allowed to fall forward and your hand's more coming up to your pec versus staying back behind you. And what that allows you to get that full elbow flexion range of motion. Whenever you flex that elbow like that, you're taking some of that stress off of that shoulder because you're not having to go so far into shoulder hyperextension right there. So that shoulder's not going to be cranked way back here. You're going to be able to drop it into a little bit more flexed position because that elbow is going to bend and your arms and your hands coming up to that pec region because of that trunk lean. So the ring dip is actually a pretty safe thing. Don't worry about shredding your anterior capsule. If you are new to ring dips and you try to do a prescribed WOD of say 50 to 60 reps, you may get some irritation. You may more likely get some biceps tendinopathy than anything else. But don't worry about your anterior capsule being shredded or torn or hyperlax, anything like that. Very unlikely for it to happen because, as I said earlier, it takes about 2,000 pounds of force to even deform that tissue 1%. So don't think about that tearing like they kind of want you to believe in this exercise. I think I'm going to stop it on those 3 videos because I want to break down the next 4 videos as well, and the next one is rather long, so I will post that again probably later on this week. I hope you all enjoyed this video. Please don't hesitate to drop any questions in the comments section below. I will try to address all of them. And once again, if you see me in the box at CrossFit, make sure you stop me and ask me any questions. That's what I'm there for. I'm there to answer any questions you may have because I want you to be training as much as possible, as pain-free as possible, especially if you're having pain with that squat. I love going over the squat all the time. So once again, guys, thank you for watching, and hope you enjoyed it.